Hey everybody, it's Alex here. So I had top surgery 1 month ago. Well, 5 weeks ago. So this is my 1 month post-op update. Top surgery was an experience. The surgery itself, it was pretty much as expected. You know, you go to sleep, you wake up, and boobs be gone. you know, it was very painful for a few days, to be expected. I mean, they just took massive amounts of stuff off of you. The pain, they of course you're on pain pills a lot, so I was pretty much doped up for the first 3 or 4 days. But after that, the pain felt like I'd been hit in the ribs with a baseball bat, and sharp shooting pains would shoot through the suture area occasionally. That was weird. And I opted for no nipples. I didn't get a nipple graft. So, and I thought, hey, who needs nipples? I don't like the sensation of the way they feel anyway. People are always like trying to tweak them and stuff, and I hate that feeling. Well, afterwards, I could still feel like the nipples were there, especially when that shooting pain was going through. I was like, but I got rid of them so I wouldn't have to deal with that nipple sensation anymore. It's kind of like ghost feelings or something like that. I thought it might look really weird too without nipples. I was going to go with tattoos later on. But, it doesn't bother me that much. I already have a chest tattoo that comes down to where the nipple would be anyway. And one little dot on this side, no one will know. Anyway, there's a whole lot of healing needs to happen before I even think about aesthetics like that. So the pain lasted a good 3.5 weeks. It's subsided to the point where I'm barely sore if somebody touches me. And it's 5 weeks on, so I think I'm over the pain bit. There was an unexpected thing though, the numbness. So there's this whole band across my chest that I can't feel at all. It goes from like under my arms all the way to the front. There's a whole like strip band right there, and I can't feel it at all. Like touching sensation, nothing. But as it was healing, it was itching. Have you ever had like a big cut, and it heals and it's itching, and everyone says, "Oh, it's good. It itches. It means it's healing." Yeah, it's healing. But but when it's numb like this, and you have an itch, and you go to scratch it, but you can't feel the scratch because you don't have any sensation there. That's crazy. That drove me nuts. The itching is gone. I'm still numb. I still don't feel anything there. But I'm to the point where I can stretch, I can move, I can get back in the gym, try to build up a little bit more. I got so soft and flabby while I was out. Aside from the physical stuff of the surgery, a very surprising thing happened. Last update, I was complaining that everyone still called me ma'am and lady and all this kind of thing. And I was a little disappointed because it's been a whole year on testosterone and I still get perceived as female. And it was bothering me. And so I went back and looked at videos of other trans men at a year, and they really hadn't changed that much either. So I was like, okay, I'll give it another year, and I'll just wait another year. It might take 2 to 5 years before the whole world perceives you as male, and I'll just have some patience. Well, as soon as I could go out after my surgery, like 2 weeks out, and I went out to the store or restaurant or something like that, everybody called me Mr., Sir, Dude. And I thought, wow, that changed overnight. Just 2 weeks ago, everyone was calling me lady. Now, after the surgery, 2 weeks after surgery, I'm all of a sudden Mr. Al. And so I was like, does it change that much? It's like an instant change of perception of other people. I did grow my whiskers out. A tiny little teenage mustache and a little peach fuzz under my chin. That may help with the perception of being male to the public, but it seemed like the surgery had an instant effect on the way everyone perceived me. So that was unexpected, but a very pleasant change. What else can I say about the surgery? I was very impatient to heal. I had the drains in for longer than most people did because I just kept draining a lot. But after about 2 weeks, the doctors wanted to pull them anyway, even though I was still draining too much, because you leave them in there too much, it could cause infection, or it might like graft in there, bad things like that. And I had a choice to go on antibiotics to prevent infection and keep the drains in longer, or just go ahead and pull them out and hope for the best. So I went that way, and I shouldn't have done that, because then I had fluid buildup in pockets, and it kind of made like little hard pockets in certain places, and I had to go back to the doctor when they put a needle in there and drain the stuff out. And I thought that was going to be horrible, but because I was so numb, I didn't feel a thing. I mean, they were sticking these huge syringes in me, and I didn't even know it. I didn't even feel it. So I have to go back every couple of weeks or something to check on that and get it drained. The draining has stopped. However, there's still like a lump here that I'm concerned about. The doctor said not to worry about it. It's a healing thing. It's like I don't know, not exactly scar tissue, but I guess like traumatized tissue or whatever, and it's still swelling and fluidy and stuff like that, and it'll go away. I hope that's true. Okay, so that's 1 month post-op. The sutures look really good. The doctors themselves were very pleased with their work, and they're like, oh, look how good this looks. This is some of my best work. They even brought in other doctors. Well, she brought in other doctors to see her work and said, look how good this came out. And I was like, oh yeah, it's beautiful. So I guess I lucked out and got a really good doctor who did a really good job, and everyone was very happy with it. Obviously, you don't have, a muscular male chest right off the bat. In fact, it kind of looks like concave, because stuff has been taken out. The muscle you'll have to build up, later. Oh, and I opted for no nipples. I did not do a nipple graft, because all the pictures I've seen, the nipple grafts, they never really look spot on. They never really look all that great. And in fact, I thought it might look weirder if I had like nipples that were a little off or a little deformed or whatever. And also, I never liked my nipples anyway. I don't like the way they feel. I don't like the way they poke out. I don't like the way they look. I think they're completely useless things. And I thought, well, get rid of the nipples, and then I don't have to worry about people trying to tweak them, which I always hated. It just feels bad and everything. And so I opted for no nipples. So I have a completely smooth looking chest, almost like an alien. I do have a tattoo right here though that goes down to where the nipple would be, so that's not really noticeable. On the other side, I'll get another tattoo of like a 3D nipple tattoo, just for visual effect, but that's way down the road. And a funny thing is, remember I was telling you about the shooting pains that went through the suture areas? So I was really psyched to get rid of my nipples so I wouldn't have that nipple sensation of, I don't like that. Well, that shooting pain would go through there anyway, and it still felt like my nipples were there, and like they were being tweaked. I was like, how can that be? They're gone. So I guess it was like ghost pain or something like that. And I thought, oh no, I'm gonna like feel the nipples even though I got rid of them. That's gonna suck. But that died down. I don't have those pains anymore, and I don't have that sensation anymore. Now it's just numb, which is in itself kind of strange. I don't know if that's ever gonna come back. I'm not too worried about it. I can get used to that. So next step is get back into a workout regimen, get healthy, get strong, and start filling out my body the way I want it to be. Now that the hard part's done. All right, I'll check in next month. Bye.